What is a CCBHC? What is a CCBHC?
That is part of work-life balance. I am off until Tuesday, so that's sounding really great, by the way. So yeah, I'm happy. This is probably just going to be a northern region group because that's okay though. So this will be a refresher for most people. My presentation was originally not going to be the entire time frame. Yeah, I mean, okay. All right. As soon as the gentleman comes back, we'll go ahead and get started. Because again, this is not going to be a long presentation. I mean, it's the last one of the day. I know we're all exhausted. We're all ready to hit back on the road, start the holiday weekend and whatnot. So while we're waiting, I see some people have. Oh, now, Chip, if you do that, then that means I'm gonna have to get a tour bus, and I'll have to find a tour bus driver and all that. Oh boy. Okay. Okay. Thank you. Yeah. Is there a lot of people left outside or? Whole group just, yeah. All right. All right, we're gonna go ahead and get started. Oh, that looks interesting. Woo! I made it. Thank you. Thank you. So just a couple of caveats. I know it's been a long day. You've learned so much. The original time frame for this session is going to be a little short. That way we can start the holiday weekend. So just wanted to get that caveat out the way. And also, the handouts were a little bit darker than expected. So if anyone would like a copy of the presentation and the materials that will be involved, I will pass out my card at the end of the session. And if you can email me, I'll make sure to send it to y'all. Our virtual folks, my email address will be at the end of the presentation, and it's also going to be in the chat as well. So watch for that. Let's get the show on the road here. And CCBHC, this has had so many different titles, but we're going to simply call it CCBHC, A Peer's Perspective. A little background about me. Again, my name is Richard Addison. I'm an adult peer support certification, peer support specialist. And I do work at the NorthKey Community Care in Covington, Kentucky as a lead peer support specialist. I'm also a RAP co-facilitator. Shout out to all those all of our new RAP facilitators that just graduated today. I'm also a group facilitator and a board of directors member at the Peer Recovery Community Center in Newport, Kentucky. And as mentioned earlier, I'm also part of the National Council for Mental Wellbeing, CCBHC Living Experience Advisory Council member. What does all that mean? Well, that means I stay busy. That's part of my recovery. Oh yes, by the way, I recently celebrated over 3 years of recovery. Part of that is from staying busy and staying active. So I know everyone's have seen so many abbreviations today and has heard so many different terminologies. PSS, MSW, CMA, ABC, LOL, TTYL, FOMO, IYKYK, CPS, F2F, MBC, WB, DTS. Yeah, you've been bombarded with a lot of abbreviations today. I get it. I know. It's overwhelming, isn't it? Guess what? I'm about to throw one more at you. CCBHC. These are going to be a couple of questions when I answer tonight. What is CCBHC? How did it start? How can these 5 letters help our communities? And what is the future of CCBHC? All that we're about to find out right now, beginning with a short video presentation.
What is a CCBHC? A CCBHC is a certified community behavioral health clinic. CCBHCs provide comprehensive, high-quality, community-based behavioral health care for children, teens, adults, and seniors, getting people into care quickly with the services they need when they are needed, regardless of where they live or their ability to pay. CCBHCs also provide 24/7 crisis intervention services for people experiencing a mental health or substance use crisis. CCBHCs meet people where they are with a range of services and supports, providing access to care and transforming behavioral health systems one community at a time. To learn more, Visit samhsa.gov/CCBHC.
I'd like to thank Madam Yutu for that wonderful introduction there. Let's talk about a little bit of history here. So CCBHC, the journey started back in 2014, being initially authorized through Protecting Access to Medicare Act of 2014. We've then moved on to 2015, released in which certification criteria and prospective payment guidance was released, and 24 states were granted planning awards. In 2017, 8 states started Section 223 of the CCBHC demonstration program. That was Minnesota, Montana, New York, New Jersey, Nevada, Oklahoma, Oregon, and Pennsylvania. In 2018, the first 52 CCBHC expansion grants were awarded with $100 million in appropriations. That's now at $385 million a year, as there are more than 450 grantees nationwide. In 2020 and 2021, I know 2020, too soon, but some good things happened. Additional states were added, including good old Kentucky and Michigan. And this is authorized by the Coronavirus Aid, Relief, and Economic Security Act. In 2022, the authorization was given for up to 10 more states to the demonstration, with states coming up every 2 years. 2023, more planning grants were awarded, and an update of the criteria was released. 2024, this year, up to 10 additional states will be able to join by July 1st. And now for the crystal ball future. Next year, 2025, 15 additional grants will be awarded. 2026, 10 more additional demonstration states will be added, with the goal of 2027 and beyond, more states added every 2 years. So this is a growing thing. And it's an exciting time because eventually this will be nationwide. So what is the criteria to be a CCBHC? These criteria can be found on the website listed. And again, for those who send an email request, I'll be more than happy to provide those direct links and the PDF files for the full information. So essentially what these criteria do is they establish a basic level of service that falls in the 6 key program areas. Those programs are staffing, availability and accessibility of service, care coordination, scope of services, quality and other reporting, and organizational authority and governance. So again, for over 2 years, I've been part of the CCBHC Living Experience Advisory Council, which consists of 9 fellow peer support specialists from across the country. We meet every month to discuss policies and recommendations to the National Council for CCBHCs. One of the biggest recommendations we have been presenting is the fact that peer support specialists need a seat at the table. And if there is no table, we will gladly build a table and bring our own chairs, because of the invaluable service that peer support specialists have when it comes to community care. We work with clinical representatives such as clinicians, therapists, medical care providers, to provide that service that isn't simply found in a college textbook, which is ironic because I am currently in college, so it's funny that I say that. But, and I mentioned this yesterday, the other day about advocacy and whatnot, and I'm a little passionate, I'm very passionate about peer support because of that therapeutic value of one person who has been there helping another person who's going through it. And some recovery rooms that said one one person helping another person. Looking at someone and saying, hey, I've been there. I know exactly what you're going through right now. And sometimes talking to someone else helps them open up to other people on their treatment team. So you talk about first line of defense, man, that's us. And it's important that community centers understand that on a local, state, and federal level. So as of right now, in terms of Kentucky and the CCBHC, there are currently 4 sites as of today. I had to write it down because I didn't put it in my presentation. So 4 of those sites are NorthKey Community Care in Northern Kentucky, New Vista, 7 counties, and Pathway. This is a growing thing, and it is the goal to have more sites in Kentucky join us. Those are just really quick. So CCBHCs, they provide comprehensive services for individuals to create a better life. We have a responsibility, not just to the people who we serve, but also to all individuals working within the CCBHC. So not only are we there for our individuals, but we're there for each other as well. As we've heard earlier in previous panels about self-care and being there for each other. And again, my role on the advisory council is to make sure that everyone in the CCBHC has a seat at the table. Everyone, regardless of educational experience and living experience, everyone deserves to be at that table, talking with the powers that be, sharing their experience, and growing together. Another part of the what the advisory council has done is we've created a booklet, CCBHC is a vision for the future of community-based behavioral health care. This booklet is available upon request via email. Which email? Well, my email. So these are some of the sources that this presentation was from, the booklet, as well as the SAMHSA website, samhsa.gov/certified-community-behavioral-health/clinics. And again, this information will be available via email upon request. So I know I said this information will be available upon request via email. Here's the email you can send it to. Please note I keep regular business hours and this weekend's a holiday. But if anyone has any questions or needs any resources or whatnot, I am available via email and office number. And as we depart from this conference, please keep in mind, 1 hour, 1 minute, 1 second, 1 decision, 1 thought makes all the difference. And whether you're traveling across the street or a few hours away, just remember, you all rock. I believe Ohio is still in the process. I know they definitely started applying, but I think they're still in the process of getting sites actually set up, demonstration sites. Yeah, Tuesday morning at 8:30 a.m. Yeah. Yes, yes. If they happen to live close by, or if they live closer than the other sites that were mentioned, they're more than welcome to go over there as well. Right. Because of the insurance and whatnot. The evil I word, insurance. But yeah. No, it's still going, actually. Yes. but mainly sample grants. We did get we were getting a grant, but that is